Good health. It's all about balance and staying in tune with your body. But intuition isn't enough. Having regular screenings is vitally important to your long-term health. And now, the latest advances in diagnostic technology can be found in a beautiful, relaxed atmosphere. Introducing our all-new Women's Pavilion, dedicated to the healing arts and clinical needs of women. St. Tammany Parish Hospital. World-class healthcare for women close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital and the St. Tammany Parish Government. We're here today talking with parents and students about back-to-school topics. We have 3 guests today on Healthy Living. We'll talk with Dr. Mary Speed, who will discuss bullying, and we'll talk with Robin Birdsong from the hospital's Community Wellness Center about vaccinations. And then we'll speak with Kristen Simpson about the Living for Burke Foundation and the importance of student athletes being screened for sudden cardiac arrest, along with the typical sports physicals. So our first guest this morning is Dr. Mary Speed. Dr. Speed, thank you so much for joining us.
Good morning. It's a pleasure to be here.
Great. Well, tell us a little bit about what you do. You're with North Lake Behavioral Health System.
Yes.
Okay. Tell us a little bit about that, and then let's talk bullying.
It's a program for youths 12 years old, males and females, up to 17, 18 years of age. Some of the children are in their parents' custody, some are in state custody. They're youths who are sort of at a time in their lives where they need to make some changes, and I guess we're a place of timeout and reassessment. And then they usually go back home or to other places in their various communities, wherever they came from in the state of Louisiana or other states.
That's wonderful. And where is it located?
It's at the Southeast Louisiana Hospital old site and a few of the buildings back there. If you're familiar with that campus, it's a huge campus. I've been lost there a couple of times already.
It's a beautiful place to get lost.
Yeah, it is.
And a beautiful resource. We're glad to have North Lake Behavioral here in Mandeville. So one of the things we wanted to talk with parents today about is bullying, because as kids are going back to school, particularly those who may be transitioning from, say, elementary to middle, or middle to junior, or junior to high, those are places and times when students sometimes feel bullied or concerned about their relationships with other students.
Those transition times are times you'll see it could be a change in a child's behavior, but it may be just because of the transition. But it's a time when people usually feel insecure. And insecurity is what seems to magnify bullying behavior, because bullies don't just accidentally pick their targets. They look for the person who looks vulnerable, and that's who they're going to go after. So some ways that parents can help is to familiarize their child with the new school setting if possible, let them be in that place, see the teachers, have the right clothes to start school. I don't know if you have, but I in past times have had dreams about showing up at school in my pajamas. It's probably a common thing that kids worry about, being dressed appropriately. Sometimes what we look for is the obvious problem. We might see a bruise that we don't have an explanation for. And that's serious enough. That can be medically attended to. But even worse, apparently, are psychological scars that children get from name calling, from regrettable nicknames. And nowadays, it's not just the face-to-face problem, but Facebook that can be a problem.
Social media.
Social
Yes.
media. So I always tell parents not to have secrets with children. In other words, have surprises. That helps a child, because when we have a surprise, we're going to tell. Sometimes children get bullied or put into situations and they're told to keep it a secret, and they're worried about it, and they don't know the whole ramifications of what may happen in their family system if something is revealed. More serious than bullying, I brought this book. I must like this book because when I looked for it on my shelf, I have 2 copies.
Oh, good.
It's called The Sociopath Next Door, and it's a scary book actually, but it talks about how in our society there are individuals that don't have a conscience. So the things that we would normally do to try to reason with somebody just doesn't work. So the only thing that can be done is actually just be a bigger bully. So here is the consequence if you do this. And bullies don't come with anything about them that would cause us to go, oh, that's a bully, we should stay away, because they're very charming as a rule. And they break down our defenses. So children need people to be attentive. If a child's change in behavior is not due just to a transition, it will last longer than what you would typically expect to see in a transition. You know, they might go to a new place and after a couple of weeks they feel settled in. But if it continues to be a situation where they seem afraid, or they refuse to go, or they're having problems regressing, maybe even bedwetting and that kind of thing, there's something seriously wrong, that they may have been forced to keep a secret about something that's happened to them, or fear that could happen to their family if they were to reveal what's going on. There are, when I was a principal of mine at St. Martinville Elementary School told a story about he had lived in a big city somewhere, and he was a tough kid. He even had like a knife scar. Ooh. And so he was in a lot of trouble, and his family moved him to a smaller community. I mean, not unlike you might see in our community, people trying to get their kids away, hopefully to a more secure environment. And that's what happened. He came to live with his grandparents. First day of school, he just started out, and he admits he looked for the smallest kid on campus and just jumped him. Everybody in the school turned around and jumped him. Wow. And basically said to him, "We don't do that here." And he said he never did it again. But what happened to him, he was so afraid he was going to be hurt. And that's often the case with people who bully. They're the most insecure people of all, unless they're a sociopath, and then they're just out to get you. But often they are scared. And when he realized in his community that he was going to be embraced, not allowed to hurt other people, he just settled in, became a great student, grew up to be a principal, you know.
That's an inspiring story, and I know that our school system does a good job of teaching children about bullying, yes, to understand it themselves so that they don't bully and they aren't prepared, if they are bullied, how to handle that.
Exactly.
Wonderful. Well, Dr. Speed, we appreciate you coming to talk about bullying today. We are working our way through 3 segments today about back-to-school issues. We've talked with Dr. Speed about bullying. Next up, we'll talk with the Community Wellness Center's Robin Birdsong. She'll talk with us about vaccinations.
Now that St. Tammany Parish Hospital and Auctioner are working together, advanced pediatric specialists can treat your child's most complex conditions close to home, giving you the peace of mind that comes with knowing your kids are in good hands.
Welcome back to Healthy Living. I'm your host, Melissa Hodgson. This show is brought to you by St. Tammany Parish Hospital and the St. Tammany Parish government. On today's episode, we're talking about back-to-school topics for parents and students. Our next guest is Robin Birdsong. She's with the hospital's Community Wellness Center, and she'll be talking with us today about vaccinations. Welcome, Robin. We're glad to have you here.
Thank you for having me.
Well, let's start off. Tell us a little bit about the Community Wellness Center and what you do there.
Community Wellness Center is part of St. Tammany Parish Hospital, as you know, Melissa, and we contract with the state for some of our programs. One of the ones we're talking about today is immunizations, and we do have vaccines through the Vaccines for Children program. We also have private pay vaccines. We have the Nurse Family Partnership program, which is a home visiting program for first-time pregnant women. And we also have a program, WIC, which is Women, Infant, and Children's Nutrition Program. Those are some of the major programs we have.
Fantastic. And you work primarily with the immunization aspect?
Yes.
Great. Well, tell us a little bit about what parents and students should be focusing on as we head back into school.
Okay, well, everybody knows when we start back to school, the school nurses will be checking records and making sure that children are up to date when they enter school. It is a state law that children have certain immunizations for school entrance. Parents who are registering their children for the first time should have an up-to-date record when they apply to the school. If not, I recommend that parents get an appointment early. Don't wait until the last minute, because they'll be in a large crowd of people trying to get an appointment at that last minute. So if your child has been immunized on a regular basis, it shouldn't be too hard to get them updated.
Great.
It should be minimal immunizations at that point.
And places in St. Tammany Parish that you can get immunizations. The Community Wellness Center would be one. People who have an established pediatrician for their children, they can go to the
Yes.
pediatrician's office.
Yes.
And then I believe the health unit in Slidell.
I don't know that there is a health unit in Slidell. There's a federally qualified health unit
Right.
where they can go to now. And there is a health unit still in Hammond. Of course, that's another parish.
Right.
But I think we took the place of the local health unit per se, but we're private.
In Covington, exactly.
Covington, yes.
And I believe there's one in Slidell that's the federally qualified office.
Yes.
So you do have options for, you go to your pediatrician's office, you can come to our Community Wellness Center, and you can go to the health unit. So we encourage all parents to make sure that their children are up to date, but tell us a little bit about, for example, if I have a kindergarten student, what shots, what vaccinations am I expecting when I take my child into the Community Wellness Center?
A child who's been kept up to date at the age of 4, or like entering kindergarten, they might be 5, they might be 6, they can expect to get 4 basic vaccines. And that would be the DTaP, tetanus, diphtheria, and pertussis vaccine, polio vaccine, the measles, mumps, rubella vaccine, and the varicella vaccine, which is chickenpox.
Chickenpox.
Now there are combination vaccines, so instead of a child getting 4 injections, they can get 2. There's a combination for the DTaP and the polio, and one for the MMR and varicella.
So
Which is nice to
thankfully they
hear.
get it over with in
Yes.
as few shots as possible.
Yes.
Very good. And then once that child starts kindergarten, they've got a few years before they need to be concerned about having any more vaccinations. And is it around 11?
Yes, in terms of what's required for school, yes, age 11. I do want to plug in there that they do recommend a flu vaccine for children every year. Yes. But then again, at age 11, the 11 to 12-year-old children will need a Tdap, which is more grown-up version of the DTaP that they had when they were younger. And then they're due the meningitis vaccine. Those are required. There's another vaccine that's recommended but not required, and that's the HPV, the human papillomavirus vaccine, just highly recommended.
Right, and that's for teenage girls?
It is for teenage girls and boys.
Boys too.
The FDA approved it for boys.
Okay.
too.
And that one, although not required, is recommended.
Yes.
And what age?
Starting at age 11.
Okay. So when you go in for that next round of shots at 11, you could opt in for your child to go ahead and get that
and if
one.
you have any concerns, I urge parents to speak to their providers, to their doctors, if they have questions or concerns about that. Also, the Center for Disease Control has a wonderful website with beaucoup, lots of information. That's French for much information about vaccines and the safety of the vaccines too.
Well, and safety is one of the things I wanted us to talk about today. You sometimes hear rumors on the internet or famous people or other parts of the country where people have expressed concerns about the safety and efficacy of vaccines. And wasn't that actually a badly done study that's been debunked?
One of the concerns started years and years ago when one doctor in England actually linked the measles, mumps, rubella vaccine to autism. That doctor's study has been refuted. He had false information in the study. He is no longer practicing medicine.
Wow.
And there is no medical study that has linked autism to vaccines. I think what parents have to keep in mind, you want to go to a trusted provider. You want to go with a child who's basically healthy. You don't want to go with a child who has fever or has a serious illness at the time. If your child has a cold, that is not a contraindication to getting immunized. So talk to your doctor about the concerns. Go with a basically healthy child. And the other thing I urge parents to do when they have concerns like that, look at the diseases. I think so many of us haven't seen the diseases because of the efficacy of the vaccines. And there were a lot of major issues, major side effects, sometimes even death with some of the diseases. So I think some parents may have lost sight of that.
Right, even if a parent has some concerns about the vaccine, if they sort of weigh the risks a little bit to say, I'm concerned about this, But if I understand the risks of not being vaccinated, my concerns would actually be greater on that scale.
Yes.
So maybe the safest choice, even though we all wish we didn't need to do any of it, the
Correct.
safe thing to do is bring your child in and get those vaccines.
Correct.
Very good. And so run through it for us again to help us make sure we do this right. Coming in at kindergarten,
Yes.
and then around middle school, 11,
Yes.
and then flu shots every year.
Yes.
And then as we finish high school, there are some other shots before we're off to college or other careers.
What is recommended now, it's not actually required, but the first meningitis vaccine at age 11 is required. They are now recommending a second booster vaccine for those kids who were immunized before age 16. So once a high school student is 16, they should get a second booster dose of the meningitis vaccine. I suspect that in the future we'll see that required too. But if your child is going to college, if your child is going to be living in a group setting like a dormitory, they should have that second meningitis vaccine.
Very good. So college or military or Peace Corps, any of those kinds of
Sometimes
things.
traveling.
Absolutely.
If you're
Lots
traveling
of
to
kids
certain,
go travel.
Yeah, certain countries where the diseases are prevalent, you want to make sure your child is immunized. Yes.
Get all those immunizations before you leave our country.
Yes, absolutely.
Very good. Well, Robin, thank you for helping us prepare parents and students for their vaccinations before school starts.
Thank you so much, Melissa.
Our next segment will be with Kristen Simpson. She's the director of the Living for Burke Foundation, and she'll be talking with us about sudden cardiac arrest in student athletes.
Which flavor? There's no right or wrong answer. The options are endless and can be as unique as our personalities, be it young or not so young. And when it comes to your family's primary care doctor, we believe you should have plenty of choices too. Exceptional care, custom made for you. Because living here means getting condensed milk every once in a while. St. Tammany Parish Hospital, a world-class physicians network close to home.
We're back with your episode of Healthy Living. Today we've been talking with guests about topics parents and students need to be aware of as we head back to school. Our third guest today is Kristen Simpson. She's director of the Living for Burke Foundation, which the hospital works in conjunction with to spread the word about the importance of screenings for student athletes in concern for sudden cardiac arrest. Kristen, welcome. We're glad to have you on the show.
Thank you. I'm glad to be here.
So tell us a little bit about the Living for Burke Foundation.
So the Living for Burke Foundation was actually started in memory of my nephew, Burke Cobb. He, unfortunately, he passed away at age 14 from a sudden cardiac arrest. He was playing basketball in his high school gym and collapsed, and he had an undiagnosed heart condition called HCM, or hypertrophic cardiomyopathy. It's something where 80% of the kids that have it do not have any symptoms until their arrest. So, and at the time, the reaction was very slow when he arrested, and the coach did not do CPR. The AEDs were locked in a closet. And
AEDs, let's talk a little bit about those because
right.
it's important not to lock them in a closet.
Very important. If you have, that's an automatic external defibrillator, which you would use to shock someone whose heart is has stopped.
And those are specially designed so that medical professionals aren't necessary.
Absolutely.
Anyone can use an AED.
The machine, when you turn it on, it tells you exactly what to do. You follow the steps that the machine leads you through, and it will only shock a person if they need to be shocked. So there's no danger in using one. Right. So anytime someone is unresponsive and is not breathing, we need to send someone for an AED and get it on their chest as soon as possible, because again, you cannot hurt someone, only help them with an AED.
And one of the things your foundation tries to do is educate about that AED. Its presence at a school. You help to try to place them at schools.
We do, and they need to be wherever you have an AED. It needs to be accessible, clearly marked with a 3D sign, so that you can imagine at a school in an emergency event, if you're running down the halls, you want to be able to look down the hall and see that 3D sign that shows you this is where the AED is, because you have a certain number of minutes when it's most effective. 3 to 5 minutes is most effective in getting the pads on their chest and shocking them if they need it.
So the AEDs are one of the aspects of your foundation. and then the screenings, educating parents about sudden cardiac arrest and about which screenings are good to have.
Right. We feel so strongly that screening your teens is just critical, because Burke had this condition and no symptoms. And like I said, 80% of kids don't have symptoms. And you may or may not have a genetic component. Like with Burke's issue, we didn't have anyone in the family that had this or any type of sudden cardiac death history in our family. So we just say screen your kids and bring them to St. Tammany. I mean, it's the easiest place to come by appointment, ages 12 to 22, and with a $150 payment, it doesn't even require you to have insurance. You get an echo, which is basically an ultrasound of the heart, which can show structural abnormalities like a hole in the heart or other defects, and then an EKG, which is the seeing the rhythm of the heartbeat, and then a blood pressure check. So, just to be sure, for peace of mind for parents, and not just once, we recommend twice during their high school years, especially if they've gone through a really serious growth spurt.
Okay, and we have a minimum age, is that
12?
12. So for example, if my son wants to play football and against my better judgment, I've said, all right, get out there with the pads on.
I understand that, yes.
We're going to have a sports physical.
Right.
But what we want to suggest is that take the step beyond the sports physical. Yes, of course, get the sports physical, but then also come and get the Living for Burke screening, because these 3 tests can tell us if there is anything going on in the heart that we should be aware of.
Absolutely.
And so he's 12, he plays for a few years, and of course, boys in particular, but teens in general. We've got all that growing going on.
Right.
Somewhere around 15 or 16, maybe do it again.
I would say that's a good idea. Sometimes they say 8th and 10th grade. It really depends on your child. You know when they're going through that growth spurt. When Burke had his arrest, he had just gone through an incredible growth spurt. He was 6'4" at age 14. So the heart grows so rapidly and the cells divide so rapidly when you're going through that type of a growth spurt. That's why it's so important. So we just recommend just do it. I mean, it's something that sports physicals are very important, and we don't want to take away from that at all. We just want to add to it, because we don't think that it doesn't do enough in terms of testing of the heart itself, and we think that's really important.
Right. And each of these 3 tests that are part of the Living for Burke screening are non-invasive.
Right.
So there's no pain, there's no injection,
No needles.
there's no needles.
Right.
There's no reason to hesitate. And some insurance does cover, and in cases where it doesn't or you don't have insurance, you've got a $150 package deal to make it a very affordable choice for parents to have that peace of mind. We've had a look. We can feel confident about letting our child participate in sports.
And I know my kids, after Burke's death, my kids were tested. And so one thing that's attractive to parents for the St. Tammany screening is that you don't have to use your insurance. So, you don't have a record of you going to take your child to get screened because you don't think that anything's wrong. Right. It's just a great test that you don't have to even go through your insurance. And I would guess, or venture to guess, that it's probably not it's probably less expensive to do it through St. Tammany than it would be to even go through your insurance. I'm just guessing.
Outstanding.
Yeah, because that's a great price.
Well, it is, and I think what it does is enable people who need it to get the care they need. And then you all in the foundation have been able to do some free screenings as well.
That's right. We have on our own, we screened about 2,000 kids since July of 2012. And we go out to community centers, to schools, and screen kids. Some of our screenings are free, especially in areas that are need it.
Sure,
so
we have areas where $150 per child
absolutely
is an unreasonable ask.
Absolutely. So we go out, but when we go out on our own, sometimes we add an echo if we have a cardiologist in that area, and sometimes it's an EKG. But either way, they're getting at minimum an EKG and a blood pressure check. Super. And it's read by a sports cardiologist. So, and we have found about 4% of the kids that we test have an abnormal result.
4%. So parents can do these simple tests for their children and come away with information. They either know we need to be on a watch because we've seen something, or we've got a good clear signal that it's okay for you to put your heart through sports.
Louisiana summers and 100+ degree heat. Yes, exactly, exactly. And I do want to add that the echo at St. Tammany, an echo is like the best test you can get because it can detect with 99% accuracy if your child's at risk for a sudden cardiac arrest. So it really is the best test.
Well, wonderful. We're proud to be a part of it, and we appreciate you coming in today to talk about it.
Well, thank you. We appreciate your partnership so much and encourage everyone to get their kids tested.
Thank you. You've been watching Healthy Living from St. Tammany Parish Hospital and the St. Tammany Parish Government. We're proud to present this show each month, and today we've been talking about issues parents and students should be aware of as they head back to school. Thanks for joining us.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.